Hi everyone, this lesson is on what to avoid when taking benzodiazepine medications. So we're first going to talk about what benzodiazepines are, some examples of benzodiazepine medications, how they work, and then we'll discuss what to avoid when taking these medications. So some examples of benzodiazepine medications include the following: Diazepam, Lorazepam, Alprazolam, and Metabolism. Now these are medications that are often used to reduce symptoms of anxiety. And it's often going to be used for treating short-term anxiety, such as when we have panic attacks or having specific phobias, those types of short-term anxiety episodes. It's not going to be used long-term. And it can also be used to treat seizures as well. Now, benzodiazepines are GABA A receptor modulators. So GABA is going to be the primary inhibitory neurotransmitter in the central nervous system. And by modulating the activity of this receptor, it's going to promote activation of GABA receptors by GABA, by the neurotransmitter, to ultimately reduce neuronal activity. So again, it acts to improve GABA neurotransmitter binding to the GABA A receptor. And by improving the efficacy of GABA neurotransmitters binding to GABA A receptors, it's going to lead to opening of chloride ion channels in neurons, and it's more specifically going to increase the frequency of chloride ion channel opening, and this will ultimately lead to a generalized reduction in neuronal activity. Now, benzodiazepine use can lead to a variety of mild and or severe side effects, including somnolence or excessive fatigue and feeling very tired, ataxia, so decreased muscle coordination, dizziness, and headache. And there are multiple foods and beverages that we can consume, including herbal medications and also other prescription medications that can worsen the side effects of benzodiazepines, and we'll discuss those in the upcoming slides. Before we talk about those things to avoid, let's discuss how benzodiazepines are metabolized. Now, each benzodiazepine is going to be metabolized slightly differently. We'll look at diazepam as an example. So they're going to be metabolized in the liver by specific enzymes in the liver, known as cytochrome P450 enzymes. And in the case of diazepam is going to be metabolized by CYP2C19 enzyme and CYP3A4 enzyme. And those enzymes will metabolize diazepam into its metabolites, and they will essentially be excreted in the urine. Now, other benzodiazepines like Alprazolam and Metabolism are going to be mostly metabolized by CYP3A4 enzyme, not CYP2C19, whereas Lorazepam will have an even different mechanism of metabolism. Now, depending on which benzodiazepine we're using, there's going to be a varied half-life. So Metabolism is going to have a very short half-life. 2 to 6 hours is often going to be the half-life, whereas with regards to Alprazolam, it can be 11 to 13 hours. And with diazepam, it can be very long, up to 20 to 70 hours, depending on patient characteristics. So again, it's going to depend on which benzodiazepine medication is used and how long it takes to metabolize it. Now let's talk about things to avoid when taking benzodiazepines in general. So these are going to mostly affect benzodiazepines in general because they have similar side effects. So some of them include the following: alcohol or ethanol consumption. So alcoholic beverages like beer, wine, etc. These should be ultimately avoided when taking benzodiazepines because ethanol acts on GABA receptors as well, also leading to a generalized decrease in neuronal activity and inducing sedation. So when taking ethanol and benzodiazepines, it can worsen the sedative effects. So it can make somnolence and drowsiness worse, and some patients can feel dizzy as well with both of these combined. Other things we should avoid taking or using include CBD oil and marijuana. And with regards to CBD or cannabidiol and its related products, these can increase levels and activity of benzodiazepines. And it does this because it affects CYP2C19 metabolism, and this is going to be more specifically a problem with diazepam. However, if we're using marijuana or cannabis, there are other components of marijuana that can lead to elevated effects of benzodiazepines through inhibition of CYP3A4. This will be more affecting benzodiazepines in general, like Alprazolam and Metabolism, along with diazepam. Other things we should avoid taking when using benzodiazepines are grapefruit or grapefruit juice. This is going to often be a food that is known to have multiple interactions with other medications. So if we're taking grapefruit or grapefruit juice, this increases the effects of benzodiazepines through its ability to inhibit CYP3A4 enzyme. So if it inhibits that enzyme is going to be important in metabolizing benzodiazepine, so it can increase the half-life or increase the serum levels of benzodiazepines, worsening side effects or worsening somnolence and drowsiness and dizziness and those types of symptoms. So this is something that should be avoided or at least limited. We can also see some interactions with St. John's wort. So St. John's wort is going to be a herbal medication used for anxiety or depression purposes. It can end up decreasing the overall effectiveness of benzodiazepines by decreasing benzodiazepine levels, and it does this by enhancing CYP3A4 metabolism. So it's essentially doing the opposite of grapefruit and grapefruit juice. It's actually inducing or enhancing CYP3A4 activity. So it's going to lead to lower levels of benzodiazepines than appropriate. So if patients are looking for anti-anxiety effects from benzodiazepines, they may not be as effective if you're also taking St. John's wort. Some other herbal medications that can interact with benzodiazepines include valerian. So this is a herbal medication used to treat symptoms of migraine headaches, insomnia, and anxiety, among other conditions. The problem is that valerian can cause sedation effects as well. So when taken in combination with benzodiazepines, it can worsen sedative effects. So if you're taking benzodiazepines along with a herbal medication like valerian, we can see worse sedation. And similarly, we can also see it if taking motherwort. This is a herbal medication used for a variety of conditions such as hypertension, menopausal signs and symptoms, and other conditions as well. And motherwort also causes sedation. So for taking these herbal medications along with benzodiazepines, we can have worsening sedation, worsening dizziness. If you're utilizing a car or utilizing certain machinery, this can make things worse. It can make you feel very sedated and dizzy. So this can be something to look out for and watch out for when using benzodiazepines. Now, some prescription medications that can have severe effects or severe interactions with benzodiazepines include barbiturates. So barbiturate medications include phenobarbital as an example. These barbiturate medications modulate GABA-A receptor activity by increasing the duration of opening of chloride ion channels. So we mentioned this before, benzodiazepines modulate the activity of GABA-A receptor to increase the frequency of opening of chloride ion channels, but barbiturates will actually increase the duration of opening of chloride ion channels. This will lead to a very significant generalized decrease in neuronal activity. So if we're using both barbiturates and benzodiazepines together, this can lead to additive central nervous system depression. And if we're using higher doses of both of these types of medications, this can increase the risk of very severe side effects like respiratory depression. So these are something to look out for when taking benzodiazepines. Opioid medications can also be something that can interact with benzodiazepines. Some examples include fentanyl, morphine, hydrocodone, and buprenorphine. So if we're using benzodiazepines concomitantly or together with opioids, they increase the risk of severe and potentially lethal side effects. These include respiratory depression, severe somnolence, coma, and death. We can see this also occurring in barbiturate medications if taken at higher doses. So these are two classes of medication that have to be looked out for when using benzodiazepines. And in fact, there's a black box warning for using benzodiazepines with opioids due to these potentially lethal side effects. Some other medications that can worsen side effects or add to side effects of benzodiazepines include TCA antidepressants or tricarboxylic acid antidepressants. Some examples include amitriptyline, clomipramine, disipramine, and imipramine. So the reason is because side effects of TCA antidepressants are similar to side effects of benzodiazepines, including sedation and drowsiness. So when taking both of these together, they can have an additive effect, worsening the side effects of benzodiazepines. And other antidepressants can also have similar effects. These include fluoxetine, fluvoxamine, so some SSRIs or selective serotonin reuptake inhibitors, mirtazapine, and trazodone. Trazodone is going to be one that is very sedating, and mirtazapine is also another antidepressant that is very sedative. These two especially, mirtazapine and trazodone, can often be used for sleep aid, and because of their effects on sleep and causing drowsiness, fatigue, they can end up worsening the sedation effects from benzodiazepines. So again, if you're taking benzodiazepines with these other medications and you're doing anything important, driving vehicles or using machinery, these are going to be important to look out for. Antipsychotic medications are also another class of medications that can interact with benzodiazepines and have similar side effects. These include aripiprazole, clozapine, haloperidol, olanzapine, paliperidone, fluvenazine, and risperidone. So there's a mix of typical and atypical antipsychotics here. But for the most part, many of these antipsychotics are going to have or cause significant drowsiness. And again, it's going to worsen sedation effects if we're taking both benzodiazepines and antipsychotic medications together. Gabapentin and pregabalin are also medications that can worsen side effects of benzodiazepines because they suppress central nervous system activity in general. So they can have synergistic effects when used in combination with benzodiazepines. So they can actually be a particular medication we have to very much look out for because they can increase the risk of severe sedation and respiratory depression when used with benzodiazepines. Another class of medication that can worsen side effects of benzodiazepines are H2 blockers. So these are histamine H2 receptor blockers. So these particular medications are going to be used to treat gastroesophageal reflux disease or GERD. So H2 blockers like cimetidine and ranitidine, these can cause increased effects of benzodiazepines. They increase serum levels of benzodiazepines and lead to higher effectiveness of benzodiazepines because they likely inhibit CYP3A4 enzyme activity. So again, that's one of those important enzymes that metabolize benzodiazepines. We can also see antihistamine medications in general increasing the side effects of benzodiazepines. So antihistamines in general are going to be used to treat allergies and motion sickness. These are generally going to be H1 receptor blockers. Some examples of antihistamines include diphenhydramine and dimenhydrinate. And it's especially going to be the ones that have the most effect or activity in the central nervous system. So if they cross the blood-brain barrier and inhibit histamine receptors in the brain, they can cause a lot of fatigue and drowsiness. And because they also cause sedation and drowsiness, they can worsen sedative effects of benzodiazepines when used in combination. Anti-seizure medications can also interact with benzodiazepines. These include fosphenytoin and phenytoin. They ultimately will reduce serum levels and overall effectiveness of benzodiazepines because they generally enhance CYP3A4 metabolism. So they're enhancing that particular enzyme, its activity, and that enzyme is going to metabolize more benzodiazepine, and it's going to lower serum levels of the benzodiazepine, so it's going to have less effect. So patients may be looking for a particular anti-anxiety effect, for instance, but they may not get that effect at that particular dose if they're also taking anti-seizure medications like phenytoin. Sleep aids can also be something that can have similar effects as benzodiazepines. These include melatonin and sleeping medications like Ramelteon. So they're essentially going to have additive sedation effects with benzodiazepines. Now, there are other prescription medications that can cause some issues with benzodiazepine function. These include macrolide antibiotics. So macrolide antibiotics include clarithromycin and erythromycin, and they often are going to lead to increased benzodiazepine effects because they end up inhibiting CYP3A4 enzymatic activity. So again, they're inhibiting that enzyme. It's going to lead to higher levels of benzodiazepine and ultimately higher effects or stronger effects of the benzodiazepine medication. Antiviral medications can also have effects on benzodiazepines as well. These include darunavir, fosamaprevir, and atazanavir. These are more specifically going to be protease inhibitors, and they're used as treatments for HIV infections. And these protease inhibitors will have similar effects as these macrolide antibiotics by inhibiting CYP3A4 activity and leading to higher levels of benzodiazepines than is appropriate. And the last medication class we're going to talk about here is antifungal medications. These include ketoconazole, fluconazole, and itraconazole. So some of these can be used as treatments for fungal infections. Some of them can also be used as anti-androgen medications. So they have anti-androgen effects as well. And they increase serum levels and effectiveness of benzodiazepines, again, by inhibiting CYP3A4 metabolism. So along with some of those protease inhibitors, these antifungals, these are some of the medications that really need to be avoided if possible when taking benzodiazepines because they can really increase levels of benzodiazepines far more than appropriate. And that can cause a lot of side effects that can in some cases be quite significant. Please check out my lesson on the side effects of benzodiazepines. And if you haven't already, please like and subscribe for more lessons like this one. And as always, thanks so much for watching and hope to see you next time.